Now I'm going to perform a telehealth assessment on a patient who has recently had her gallbladder removed and is complaining of abdomen pain, vomiting, nausea and vomiting, and diarrhea after eating. Hello, my name is Tamara. I will be your nurse today. Please be sure you are in a quiet area with good lighting for proper understanding of both parties with no distractions and is in a private location.
Hey, Miss Tamara.
Hello. Please tell me your first and last name.
Tanera Haddock.
Hello, Tanera. And your date of birth?
08/28/1994.
Perfect. Thank you. And do you have a phone number I can call you back on just in case the connection goes out?
252-916-7003.
Perfect. Thank you. And then tell me why you called in today.
I've been having some diarrhea. It's been pretty loose and it's gray looking.
Okay.
I've been having some vomiting, some nausea, of course, and it's typically after I eat. So it's been hard to kind of eat because I'd be scared to have a stomachache.
Okay. I'm sorry to hear that.
It's just annoying.
Gotcha. On a scale from 0 to 10, was 0 being the least and 10 being the most, what would you say your pain score is?
It's about an 8 or 9.
8 or 9. Okay. Have you took any medications to help with this pain?
No, because I felt like previously when I was taking stuff, it wasn't really working. So I try to just ride it out or not eat so I don't feel like this.
Okay. Has anything made it better or anything made it worse?
I wouldn't say that anything. Maybe if I eat a salad, that's probably the only thing that helps.
Okay.
Which probably means I'm eating junk.
What have you been eating lately?
If I'm being honest, after I had my gallbladder removed, I feel like I can go back to being normal, even though they told me to be on a low-fat diet. So it's okay for a little bit, but I like cheeseburgers. I love pizza. Macaroni and cheese is my comfort go-to. Alfredo, love it. Need to have it. So yeah. It's hard that during those times of the month, for sure.
Yeah.
To make better decisions.
All the good stuff.
All the good stuff.
Cheeseburgers, pizza, okay. Okay. All right. And if you don't mind, if I can just see your stomach.
Yeah. 1 moment.
Just turn to the side for me. All right. Thank you. All right. And do you have any signs of infection? Has that wound over there turned any signs of the rainbow, like yellow, red, purple, green? Okay. Have you felt like you had a fever at all, chills, or have been overly hot?
Not at all.
Okay. And you said that your stool has been loose and gray looking?
Yeah.
Okay. And then your vomit, what has that been looking like?
Just look like whatever I ate.
Okay. And the nausea and the vomit, has that been directly after you've been eating, or is that throughout the day?
I'll say directly, maybe 15-20 minutes, if that, after I eat.
Okay. Have you lost any weight recently?
No.
Okay. Do you have any family history of GI issues?
Not that I'm aware of. No, ma'am.
All right. And then how recent was this gallbladder surgery?
It's been maybe 3 months now.
Okay. All right. So it sounds like these symptoms are due to the diet, the fatty diet, the cheeseburger, that macaroni cheese, and the pizza. So it looks like you need to change your diet over to more so the vegetables and the fruits and things of that nature. So especially within the last few months, these symptoms are very common. So the gallbladder helps digest the fats, and with the body not having this organ, you would have these typical GI issues like the diarrhea, the bloating, the gas, and the abdomen pain. So a low-fat diet, increasing your fiber and eating smaller but frequent meals will help with these issues. Also for that abdomen pain, making sure you can take some Tylenol or take an ibuprofen, but making sure you take the ibuprofen with the meals, because ibuprofen can increase the common symptom of abdomen pain. Can help with the abdomen pain. So ibuprofen and Tylenol will help with the abdomen pain. If the diarrhea and the nausea and vomiting or the abdomen pain does not improve with the Tylenol and the ibuprofen and changing your habits of the diet, make sure you help or seek help from the primary healthcare provider, okay?
Okay.
Do you have any questions for me?
Can I get a cheeseburger every now and then?
Oh, no, ma'am. Try to stick to especially right now since the gallbladder surgery is very fresh. Okay, so try to stick to that diet. Okay. Do you smoke?
No.
Okay, good. And then how is your water intake?
I drink at least half a gallon every day.
Okay, good. And then how is your alcohol intake?
I don't even drink alcohol like that. It may be like once a year. I might get a drink or two.
Okay, good. Okay, sounds good. All right. And then do you have any questions for me?
Nope, I just wanted that cheeseburger.
No, ma'am. All right, so all of your recommendations will be in your after visit summary that is located in your Epic account. Do you know how to get to your Epic account?
I do.
Okay, good. All right, well, if you don't have any questions for me, I'll let you go.
Okay, Miss Tamara, you have a good night.
Thank you, you too.